So not all class twos are created equal. So when I realized this, it created a bigger question for me, and I've kind of hinted toward this. With such a variable or variance in what we do with class twos, how can we expect a single system to handle every single case in an effective and efficient way? And the reality is it's kind of hard to do that, right? So we need multiple tools to be able to solve different situations depending on what we run into. And that's where I came up with this idea, and I call it BurtonBands posterior. And the BurtonBands posterior, you can see here, and we're going to see it from a few different angles, but it's essentially it's a wedge matrix unit in one. And if you look at this from a couple different angles, there's two key components to it: the wedge, of course, and the matrix. And the wedge has a unique design that splits. So the wedge wings here are not bound at the tip. So these wings can float independently when you place them in the embrasure. And this does a key thing. It allows the side that's attached to the matrix band, which you can see here, this side right here, it allows that wing to float with the tooth around line angles and helps create good contour and good matrix seal all the way around the curving angles of the teeth, because our teeth aren't flat, right? So they're always curving, they're always changing directions. And the other thing is a very designed or contoured matrix band. So when I designed this, I wanted to put a marginal ridge in this, and so it would have it built in and ready to go. And so we would have to do as minimal amount of polishing at the end as possible. And so this is what the design of the system is: splitting wedge, matrix band, and it is a very effective device in certain situations. And this is just a couple different angles. We will drive into this. So where is it effective for? And I say it's a unique tool for unique situations. So what I was talking about earlier, not all class twos are created equal, right? So for a majority of what I do, I'm using standard matrix and ring systems, and that's the most efficient thing for me. But when I run into these situations, and I'm going to go through a few different ones here as we go, then this is when I start to use it. And one of the cases is the unexpected class two. For example, you get in, you're doing a class one, you're set up for a class one, you have however many minutes, 30, 45 minutes to do it, no problem. And then you kind of start to clean out the mesial portion of that class one, and you realize that it is indeed a class two. And so it's one of those great things that you can just pop it in there, because a lot of times those aren't that large of lesions, because you didn't see them on the radiograph, they didn't show up, but they were there clinically. And so it's a great little thing to pop in there and just be able to bail you out. Another area, mesial lesions on second molars or the poor access and short clinical crowns. So, these areas of poor access, and which is the second molars, they have a lot of variables that they throw at us, right? It's tough to get to. The crowns are short, so a lot of times our ring systems have trouble engaging them, and it's hard to see, and we want the fewest things possible back there to not impede our working environment. In another section, interproximal root caries below an existing restoration, and we'll go over all these. Tight embrasure scenario that I was talking about, MOD situations, mid-ortho class 2, this is an interesting one, and mesial lesions on first bicuspids. And so let's dive in. Unexpected class 2 scenario, just like I mentioned before. So this patient came in, and believe it or not, it was just a removal of an existing amalgam, and that's the darkness that you can see down here. And when I got in there, there was a small fracture line on the mesial marginal ridge, but it didn't look too damning, and radiographically it was clear. And then when I got in here, it turned into this, and you can actually still see that the fracture went even further. And so these types of situations, they can really disrupt your schedule, right? Like you're planning on doing one thing, and now all of a sudden it's kind of exponentially harder. And it's nice to have a go-to tool to kind of bail you out of these situations. And so this is the BurtonBands posterior placed in that situation. And so you can see the wedge handle, and you can see the splitting wings on the palatal side here. So Most of the time I'll insert it from the buckle direction, but it doesn't have to be that. This thing's extremely versatile, and I'll drive that point home a few different times tonight. It's like you can use it however you want, and I'll show you a few different ways to. So you can insert it palatal or facially, it doesn't matter. But you can see the wings split here, and that's the papilla right in the middle. So that wedge being able to split allows the matrix band, which is attached to that portion, to kind of follow the tooth all the way around. And then you've created this little home for your restoration. And in this case, all we do is restore. So in cases like this, where you don't have a super wide prep, you don't necessarily have to use a ring. You can if you want to, and I'll show you how to do that later as well. But in these cases where you have, a pretty tight wedge here going in, you can just burnish this matrix band and be done. And so that's what we did in this case. That's immediately after, and that is the final restoration. And I took a radiograph immediately after just to kind of see how effective this was in these, because that restoration went subgingival, as you could see there on the previous slide. And this was before I did any occlusal contouring on this, but you can see how nicely it sealed the gingival margin up in this area. And again, it's just a nice bailout tool. It's not for every single situation, not for back-to-backs, not for a ton of quadrant stuff, but when you find yourself in these situations, it can do a good job for you and help you get through that situation relatively quickly. Next scenario, the poor access, the one we've been spending some time on, and this is really the area that it's most effective, for me, is these short clinical crown scenarios and just really difficult area to reach. It's hard to get 8 things back there to solve it. And when I can get my ring and sectional matrix back there, I do, and I get it done. But sometimes you find it very difficult to do. So this is a patient, and I took this picture and I left the cheek in here and everything on purpose, because I feel like a lot of times we see these images and we don't get a true perception of how difficult the case was, right? Like the images can make it seem like we had more access than we did, and that, I had a mile to work with. This was me struggling to get, I took this picture probably like 7 different times to get one image. And so I was working in an extremely tight environment back here, and the patient's masseter muscle and cheek muscles and cheek tissue was just like collapsing in on me. And I'm not a huge rubber dam guy. And even if you were, then yeah, you wouldn't have the cheek in your way, but you still have limited opening. And so the patient also had a hard time staying open. And so I would have to go in and out in spurts. And when these cases get tight, placement of matrix systems back here gets a little tough, and we don't have much height to work with. And so that's where things get clumsy, and we need something to just kind of bail us out. And so this is a good example of me actually placing the system from the palatal. So if you look here, you can see the preparation's done, Vitribond laid down, etched everything. And I like to do all my etching before I place my matrix bands in. And the reason is I don't like to put any liquid in after I place my matrix band. So I try to keep the area completely dry. So I'll etch everything before, rinse it off, dry it off, and then place my matrix band. And so we did it from the palatal in this particular case. 2 reasons. 1, I didn't have a ton of access from the buccal. 2, I had the easiest path of insertion from the palatal. It was like a slam dunk. And so you can use it from either direction. Place the system here, burnished and restored. And you could see the gingival margin, seal here. So it's kind of checking off all the important boxes for us, right? Gingival margin seal all the way through, matrix bands covering the buccal and lingual aspects of the box. That's all we need. We don't need a matrix band that goes all the way around the tooth. It's okay. We just need it right here, right? This is our working environment. And so placed in there, pop the restoration in, and the patient was on their way. Interproximal root caries scenario. So this one I'm going to show you from start to finish. You're going to see the beginning and end. These are tricky, and they'll never be easier. And patient came in for routine bite wings, and you can see number 4 has one, and number 30 does as well. But we're going to focus on the number 4. And so when we get into these cases, like I was saying, the weird physics, right? So we get into these root caries, and why are root caries so hard? You know, and part of the reason is they're hard to restore, right? So a lot of times our tools start to act a little bit outside of what we're expecting them to behave like. And when that starts to happen, then things get real really fast. And so finding something that can just kind of bail us out of this is key. And wedging these is the big issue, to be honest. And so let's show the preparation. And so, and we're familiar with this. And again, I take pictures with the raw, right? So this is what it looks like. I'm not going to clean all this up. I'm not going to put hemostatic agent here and pretend like, you know, that we're magical in our hemostasis and everything. It's like, we open this thing up, this is what we see, right? We got bleeding, we got subgingival, we've got a kind of a weird shape, and that extended a bit to the palatal here. So this can be a bit of a tricky situation, and matrix insertion can be tricky here, wedge insertion, you know, which way you're going to go. And ultimately the big one is at the bottom here, you know, hemostasis and quick control. And we need to be able to isolate this quickly. We need to be able to do it in one shot, and to be able to get in, get done when we need to get done, and get out. So this is the posterior matrix system inserted. And now when I inserted it, you can see that, you know, you can see the marginal ridge built in here. This is a pretty good shot of this. And when I inserted it, I noticed that my contact area was kind of open because the molar was heading in a bit of a different direction. So my matrix system had to follow the contour of the tooth, right? The preparation, which was essentially on root surface at this point. And my matrix band, despite trying to reach all the way over there, didn't quite make it to a super closed or as broad of a contact that I would like from the mesial or the buccal lingual dimension. And so what I did was placed a ring on it. And this is the Wago matrix ring. And it is I think it is autoclavable, and Jason will touch on that later. I'll let him answer that question. And I think you can get a few uses out of it, but it's a V, you know, it's kind of like a V ring, very similar to Triodent, Paleodent. And so you can see that all I did was when I placed the ring on, I engaged the wing of the wedge that was attached to the matrix band. And you can see the other wing here is just somewhere in the middle. It's just hanging out under the V. The other side went over the handle. And so when I placed this ring, now you can see that my matrix band was able to be approximated to the neighboring tooth. And that allowed me to make sure that I got a proper contact. So again, I'll go back to this slide. So you can see here, I appreciate that the matrix band was being pulled away from the tooth due to the shape of the preparation and the fact that it extended palatally. So I placed the ring on top just over this wing, and that allowed the matrix band to touch the neighboring tooth. And this is immediately after that visit. And so you can see that we have our contoured restoration here. It follows the original form of the tooth, didn't have to deal with any overhangs in this area. And again, just one of those situations that can kind of drive us crazy, and unique tools for unique situations. And the radiograph at the end, you can see here, nice, real nice seal here at the gingival margin, and nice contour. And you can see how it kind of mimics the mesial contour of that tooth as well. And once the papilla and everything kind of heals in there, it won't be quite as big of a triangle. But when you have patients with periodontal, you know, issues, and you have these shapes coming from these directions, you're gonna get triangles. And so just trying to get a real nice proximal contact here and really good gingival marginal seal, and encourage excellent, you know, oral hygiene to help keep those margins clean. Tight embrasure scenario, and that was the one that I was just in earlier this afternoon. And these can be a real bear. It's probably, I think this is probably the hardest thing of the class 2 situations. And the reason it is, and I wrote here, tight embrasures can be ridiculous to restore. They can really make you feel like you're trying to work with your feet in the mouth. And the reason that they are is, I think, largely because they occur mostly between the first and second molars, which is already a hard area to work in, right? So it's kind of unfair. It's like, why does it have to be even harder back here? I can barely get my stuff back here to work. It's hard for me to see. I'm tired. It's the end of the day. And now you have to throw these tight embrasures at me, and they can just really, really mess up your day. And one of the reasons that they're really difficult is that even if you prep them and you prep them well, there's just like the embrasure and the tightness in the embrasure and the contact area is just like a mile wide, and so you're trying to put your matrix band in, and it's denting and it's getting hung up on the margins down here. And what I've ultimately realized is that in these super tight embrasure cases, like in certain situations, it might be better to insert the matrix laterally and allow the matrix band to kind of like creep in here from the side instead of trying to do it from the top down. And that will allow a little bit of an easier insertion path and allow us to resolve the situation. And so in this case, this is what I did. And so I'll show what we did to modify this wedge, and I'll show it in detail later, but you may notice that there's only one wing on this wedge right now. And so when I get into these super tight embrasures, let me show this area again. When I get into these tight embrasures, the size of our wedge is going to matter, right? Because if you look at the space here and it's full of papilla, we can't put a traditional wedge into these areas. It's very difficult to do because there's not that much space. And sometimes you can identify these tight embrasures on x-rays and kind of be, preempted to be ready for it. And other times it looks like it's not tight, and then you get in there and it is tight. And so trying to fit the full wedge here may be overly difficult. So what I do is I snip off one of the wings, the wing that's not attached to the matrix band, and that gives me a nice skinny wedge wing here just to be able to glide into position there. And again, you can see we got gingival margin seal in this area. We've got our matrix band just covering our buccal and palatal portions of the preparation, and that's all you need. You don't need the matrix band to go, all the way over here. It doesn't have to do that. And if it did, it would make it really hard to put this in. And so this little guy squeaks right in there. Again, the lateral insertion. And in these cases, the matrix and the wedge are so snug in there. This thing is like tight in there that if you get that kind of snug insertion and settling of everything, then I typically do not use a ring. You can see my matrix band was approximated nicely on the tooth there. And that's immediately after the restoration, and that's immediately after polishing. And doesn't take long to do those when you get into those situations, and it's a quick way to kind of bail you out of those tight embraces. And the MOD scenario. MODs can be tricky too. I'd say they're the second trickiest. When you get on bicuspids, we have a lot of hardware in a small area, right? Especially if we're trying to do it in one swing. We've got 2 matrix bands, we've got 2 wedges, we've got 2 rings. And if you try to do it with the 360 Toffelmeyer style matrices, that can also be difficult because then you got the arm coming off of that thing, which will hinder the mesial placement of the wedge and the ring. And so essentially what happens is we can run out of working space very quickly in these situations. And additionally, when we start to run out of working space, our tools may start to interfere with each other. And one thing that I was noticing a lot on MODs, and this is not for every situation, but bicuspids, and keep an eye on that, even if you want to take something from this webinar tonight. If you're wondering why MODs, you end up with big flash chunks here on the buccal or the palatal line angles, a lot of times it's because your matrix bands are interfering with each other in these areas because they have nowhere to go. And so you can trim these down to make it a little bit easier, but a different way to do it is to pop these things in. And then now I've got less matrix band and less setup and ready to go, and place the ring on this guy here. You can see here how it split it, and I used the Wago or the Wago ring here and popped that in there, filled everything. And our final situation in this situation. So MODs are pretty slick. And so it keeps a lot of the stuff out of your way and allows you to have a much cleaner working field in these certain scenarios. And again, do I use it for every MOD? No, I don't. But this was, if this looks familiar, this was that super poor access case. So I ended up restoring multiples on her, and this took some time because I had to do individual restorations as we went, but it was really the only way I could get back there. In her case, is I had to break it up over time. And so I was prepared for that. And in this case, we deemed it necessary to use something that allowed us to get a minimal access and MOD situation here, and the posterior matrix handled it quite well. Mid-ortho class 2s, we see this often. Patients come in and they've got caries interproximally, and when they have wires on in brackets, it can be a little tricky to restore, and it can also be tricky to organize because, you know, a lot of times we don't want to be snipping those wires and causing orthodontist more work, or, you know, maybe the patient's not going to follow up with the orthodontist. So it's like, do we call the orthodontist? And a lot of times kids have limited schedules during the school year because they're playing 3 sports and they're doing all this, and so scheduling becomes difficult. So this is one of those cases that it's a bailout where you end up with one of these class 2s and then simply just insert it from the lingual or palatal, and the wings will float underneath of the bar, and you can just pop this matrix system in there and do your thing and restore this class 2 with ease right around those. And finally, the mesial lesion on the first maxillary bicuspid, third most difficult area to work. And this little area is so tricky. It's almost as unfair as the tight embrasures between the first and second molars. And main reasons include, one, we're transitioning between an anterior tooth and a posterior tooth, right, in one little slice here. So anterior matrix systems or anterior techniques work on this tooth, posterior situations work on this tooth, but when you butt the two up, it gets tricky, right? Ring placement can be a little dicey. And on top of that, we always have a cute little concavity or at some level on the mesial of this root. And so it's kind of one of those situations that we look at and we're like, oh gosh, you know, we always know, we're always warned about this area. And so it's one of those that's, again, a bailout situation or a bailout tool is very effective to kind of overcome those challenges. And again, I told you I like to etch the tooth all the way. So I'll etch just like this, keep the patient open and let it sit for 30 seconds, rinse everything off, dry it, and now I have a dry field to place my matrix band. So if you look carefully here, you'll see that the matrix band is actually sealing the entire floor of that gingival margin there, which even took that little concavity shape. And that's a great thing. It's a great easy tool to be able to pop in there and kind of solve that situation on an isolated lesion. And it also gets us past the fact that we're in between, you know, we're in between types of restorations, and we got an anterior here and a posterior here, and that's where our systems kind of, they can struggle. Now, if I have room to on the canine or contour on the canine to put a ring, I will. But sometimes we need these, you know, these scenarios where the canine has a real steep lingual incline and nothing wants to grip it, and it's hard to get a matrix band in there and a wedge and just hope. And so this gives you a little bit more control over those certain scenarios where you can effectively handle these situations. And in this situation as well, you can see that the embrasure was a bit tight on this, and so I'll show you how I trim these wings. So this is the standard matrix wedge setup right here. Very simply, take a pair of scissors and cut the wing off. And you don't have to cut the wing off, you know, you don't have to cut it all the way by the handle because it doesn't even split that far, but just cut the initial half off, and that allows this leading tip to get into that area, and you're still keeping like the body of the wedge itself. And so you're still going to be getting separation because the tip of the wedges aren't doing any separating. It's all here in the body, near the handle surface of any wedge for that matter. And so that's the remaining tip right there. And then this is the modified wedge, and that's placed in there. That's immediately after restoration. So again, you can see only one wing here, and that's final after polish and a little bit of finishing.